So New York's medical marijuana program wants to include a proposal that would put medical marijuana in schools. Since the health department wants to give schools a way to possess, secure, and administer medical marijuana products under limited circumstances. And also, the proposal was part of a dozen recommendations quietly posted by the health department on its website to also include allowing nurse practitioners to certify patients for medical pot, approving 5 additional marijuana growers over the next 2 years, and adding chronic intractable pain to the list of conditions approved for marijuana use. Of course, there's Republican opposition, and that would be one of them, Senator Martin Golden, Republican from Brooklyn, who says, "I think the last place medical marijuana belongs is in our schools." And maybe, if you took that same hardline approach on all drugs, Ritalin and Adderall, whatever else they're prescribing kids these days, they can take those in school. They can take those. The nurse practitioner at school administers those. They make sure they have people's medicine that they need or whatever. It's never been a problem with other medications. Why would it be a problem now? Well, of course the Republicans got their reasons, and we know what that is. Their deep ties to pharmaceutical industry. Medical marijuana advocates hailed the recommendations as much-needed steps towards improving access to the drug, and they noted that some seriously ill children depend on the drug, but under current law are unable to take it at school. That's bad. Kate Heinz of Compassionate Care New York is quoted as saying, "We are not talking about anyone coming into school smoking raw plant materials. These are tinctures or pills." Well, eventually maybe we'll figure it all out, but just saying outright that no medical marijuana in school, that's not very good. That doesn't recognize marijuana as medicine very much now, does it? So it'd be a conflict of interest for the New York government, who's initiating their own medical marijuana program, to then say it's not medicine somehow. So, contradictory. The health department said the recommendations were still under review and further steps would be announced in the next 2 weeks. The recommendations are based on an agency's experience over the past 7 months and information obtained from doctors, patients, and caregivers, the department said. When New York launched this medical marijuana program in January, it had 5 companies licensed to grow and distribute the product, and each company was allowed to operate 4 dispensaries. So far, 667 physicians have been approved to prescribe the drug, and 6,834 patients have been certified to receive it. The state senator Diane Savino, Democrat from Staten Island, who sponsored the legislation that legalized medical marijuana in New York, said the new recommendations would eliminate barriers to people receiving the drug. Quote, "I think every one of them is a smart move," she said. Well, we'll see how that develops. This is carefully enacted medical marijuana law in New York. It hasn't had broad, outreach, I guess you say, past the New York City area. And even there, it seems like it lacks in participation overall. It's a slow rollout, like they always are when the legislative branch is passing it, and we'll see how it goes from here.